Hi, welcome. We're just going to spend 10 minutes with Dr. Kerry, and he's going to tell us a little bit about how he presents Module 1 and 2 for BodyTalk, and also his Orthopedic Physical Assessment courses for BodyTalk. In New Zealand, we're really looking forward to you coming over next year. So we've got you coming over and doing Module 1 and 2 the last weekend in April, first couple of days in May. And then the following weekend, we've got you doing orthopedic evaluation for BodyTalk as well. So the reason for the Skype chat is, how about telling us a little bit about Module 1 and 2 and how you differ from other instructors and how you put the course across?
Okay. I think there's a lot of good Module 1 and 2 instructors. And I think for the student, it's important for you to know a little bit about the instructor, because each instructor adds their own little flair to it. My background, for those that don't know me, is I started off as an athletic trainer. So I did a lot of taping of ankles, doing a lot of sports injury rehab. And then I became a physiotherapist. And what I found was physiotherapy kind of prepared me to treat, physical, mechanical type of dysfunctions. And I felt sort of inadequate treating patients that came in with emotional or consciousness issues. They would come in like with a knee problem or shoulder problem, but it wasn't mechanical. It was due to something else. So I ended up going into study acupuncture, became a doctor of Oriental medicine. And then after that, I studied osteopathy. I studied the traditional osteopathy, and I went and studied in England, the classical osteopathy. So when I teach Module 1 and 2, I'm bringing all that information with me. I get very sort of detailed orientated with all the anatomy and the physiology. So we study everything in great depth. The organs, the endocrine, the body parts, when we study the nerves, the lymphatics, all those different systems. I also have a really good background in emotion and consciousness work. So I kind of delve into that as energy as well, being an acupuncture physician. One of the key things that I do in class is I follow a critical thinking sort of outline. Is I do a lot of asking questions of the students, and each day we do review. It's not about just me getting up lecturing all the time. It's important for me to find out, what does the student know? What are they getting? So what we do each day is that we review. What do you know about this? What are you missing? And then I fill in all the pieces, hands-on. And I think one thing that separates me from a lot of the other instructors is I do lots of demonstrations. Because of my background, I do a lot of orthopedic evaluations. We test range of motion, we look at posture, we feel maybe some tension tests of organs and maybe a shoulder, knee, or spine. And then, we'll do a scar release. We'll do an organ or an endocrine release or body part. We'll do something different, or lymphatics. And then you can see the change. So what I want to bring to the table is that when you take Module 1 and 2, you see how that is actually stored in the patient's body. The physical injuries, the emotions, the consciousness. And when we do a BodyTalk treatment, it's important for you to see the changes. So just a lot of information, anatomy, physiology, lots of review, and lots of demonstrations. That's sort of the difference that I'll bring to the table.
That sounds really exciting, especially for those who've never done Module 1 and 2 before. It's going to be an awesome introduction to the BodyTalk system, and also an excellent review for those of us who've been practicing for a few years. That sounds really exciting. Let's go on to the second course you're going to do then, the Orthopedic Eval. Now, I've sat through your course in Australia earlier this year, and it was absolutely awesome. And I'm a physiotherapist myself, so came away with a real good review of the tension tests and range of motion tests, which we kind of, sometimes we just need that ourselves, every now and again, and enjoyed the energy side of things too. So what can we look forward to with the Orthopedic Eval in New Zealand?
Well, first of all, this orthopedic evaluation class was, John was the one that asked me, John Beltime, to set it up. When I first started studying BodyTalk, I was a closet body talker. I didn't tell anyone I was doing it. For about 2 years in a row, I would be working with patients. I would be, evaluating their knees, their necks, etc., and just doing BodyTalk. And I treated a couple thousand patients. I had to do this because BodyTalk seemed so simple, yet it was so profound, and I just had to keep doing it again and again to kind of prove to myself. Once I accepted it, John asked me to start teaching it, and the first class I taught was for about 17 chiropractors. And so they all have their arms folded like this, looking at me. So I said, well, the first thing I need to do is a demonstration. So I brought some of the guys up, we evaluated the neck and the back, and I got them to feel it. And then I would do a simple BodyTalk treatment, and they could feel the shift So their arms went from like this to, I wonder what he's doing. And so it was a great idea, and John sort of heard word of it. He says, you know what, we need to develop a course that maybe some of the other instructors can learn so it can help them teach. But also what John Veltheim was interested in was building up the credibility of BodyTalk. And one of the ways that we can do this is actually through orthopedic evaluation. I've been doing BodyTalk for, I guess, about 12 years now. I was with John when he started back in the late 90s in Sarasota, Florida. And since I was there from the beginning, you know, I've seen the changes. John's basically been my only teacher, so basically everything I know was from him. And when I started to utilize the BodyTalk, I saw a huge shift. People weren't really tapping into what was really happening in the body. And when you take the orthopedic class, you're really going to see this. If you've ever done module 4 and 7, they talk about body armor. They talk about how your body kind of absorbs all the consciousness, emotion, and physical injuries. And you'll see it in the patient's posture. You'll see it in the range of motion because they won't be able to move as free because those tissues are holding on to those emotions and consciousness. And so in this class, what we're going to do is we're going to evaluate each other. We're going to learn to observe posture, see where we're kind of keeping that tension. We're going to evaluate range of motion of the spine, the upper and lower extremities, the rib cage. And so we're going to be able to see, because if you have restrictions somewhere, you're going to have limited range of motion. We're going to be able to tap into that. The other key thing, a majority of the course is going to teach you to do tension tests. Tension tests are very gentle. We can feel all the lower extremity joints and the bones, the upper extremity joints and the bones. And I am saying bones. Most physios are used to just evaluating joints, but we're actually going to evaluate bones because they're kind of hollow and they can carry a lot of tension in there. A lot of injury can be stored there. We're also going to check the organ system in the abdominals as well as the chest cavity. We're going to check the cranium and cervical, thoracic, lumbar spine, and rib cage. So we're going to be very thorough. We use the ARTS principle from osteopathy. A stands for asymmetry. So we look for any type of asymmetry in the body. R stands for restriction and motion. We look at range of motion. We look to see what's normal, what's abnormal. The T stands for tension tests. We're going to do tension tests throughout the whole body. S stands for sensorial changes or for like tenderness. Also special tests. We're going to teach some special tests to help you with your evaluation. So the key thing that you're going to see in this class is we're going to do lots and lots of evaluation. And we're going to integrate this with mindscape techniques, or we call it innate scan. So basically you're going to have like 3 people. One person's going to lie down, and you're not allowed to touch the person at all. Just using mindscape techniques or innate scanning, you're going to observe the patient's body, and you're going to write down where you think the areas of tension are. Then you're actually going to physically touch the body and see how accurate you are. The first time you do this, people are kind of 50-50. But by the second and third time they do that, it's incredible how you're developing your keen sense of innate scanning as well as your physical skills. So we're going to include all this together. And my hope is once you've taken this class and you go back to your office, is that you start to utilize it right away. We're going to show you different ways that you can use it, the long version as well as short version. And I think this is going to help you if you're a teacher, if you're doing research, but also if you're a practitioner. Your patients are going to see the changes. When you show them the before and the after, they're going to get excited. They're going to tell their friends. That's a great way to build your practice. But most of all, it's going to help you because you're going to see how effective this system is. And that's what I felt. For those 2 years that I was a closet body talker, I was basically insecure. By doing these tests day in and day out, 20 patients a day, you become quite secure with it. You realize that this technique works.
That sounds awesome. Thanks very much, Kerry. I'm just going to continue this by giving everyone the details of when the courses are and how to register, and really look forward to seeing you in the new year. Thanks for taking the time. Take care. Bye. If you're interested in attending these courses, Module 1 and 2 is going to run from the 29th to the 2nd of May in 2011. There's early bird discounts available till the 1st of April for the first 12 newbies coming on the course. Likewise, early bird discount for the first 12 newbies coming on the Orthopedic Physical Assessment course. Follow the links below. They will take you to the International BodyTalk Association website where you can complete your registration. I will then get your details and forward on information on how you're supposed to pay. Okay. For those health professionals out there who have already completed courses in orthopedic physical assessment, such as physiotherapists, chiropractors and osteopaths, there is a substantial discount for that course but you must have done module 1 and 2 beforehand. So I look forward to catching up with all of you who are interested in coming on the courses next year, and good luck till then.